Hello, outstanding kids. Welcome back to class. Today's topic, we are going to be talking about drug education. Looking at is prescribed drugs. Prescribed drugs are the drugs a doctor or a health practitioner recommends or advises a sick person to use. The doctor will also explain the quantity of drugs to be taken, the time to be taking them, the intervals before taking the next dose, and when to come back for checkup. While non-prescribed drugs are drugs a sick person decide to use on his or her own discretion without visiting the doctor for a prescription. This action is also known as self-medication. You just look at yourself, you say, no, I'm feeling headache, so I should take paracetamol, or I'm running temperature, so I should take these drugs. That is known as non-prescribed drugs. Next one we'll be talking about is drug use. What is drug use? Drug use is taking prescribed drugs to treat a particular ailment or infection. The drug must be obtained from approved sources like a pharmacy, not going to buy in the bus. The right drugs must be taken and at given interval, not when the doctor will tell you to take it in the morning, you go and take it in the afternoon. That is not drug use. Drug use is when you take the prescribed drug by the doctor at the right time. Drug misuse is taking or using the wrong drugs to treat a sickness. You have cold or you have measles, you go and take drugs that is to cure tuberculosis. That is misuse of drugs. It's taking or using the wrong drugs to treat a sickness. For example, treating malaria fever with antibiotics capsule instead of taking malaria drugs. It's known as what? Drug misuse. Drug abuse is the next one. Drug abuse is taking a particular drug above the normal dose. It is also taking drug in order to feel high or extra strong. It also includes taking drugs without following the recommended time for its use. Drug abuse can also lead to drug addiction, and when you are taking drugs like that, even when you are not sick, those drugs will not work because you've already misused, you've already abused the drug by taking it anyhow. Of examples are some people who take antibiotic capsules every day for months to prevent infection, pain relieving tablet, that is like paracetamol. Anytime they have any little, instead of them to go and take a lot of water and rest, when you know you're already stressed, you go and be looking for paracetamol to take every day, whether they have pain or not. There's some persons take tablets to enable them to sleep. Energy booster, they say they don't have strength, they go and buy the drugs to give them strength. There's some persons take bad hard drugs, those ones that you know, as you hear them say cocaine, to smoke it. All these are known as drug abuse. It is not something that we should engage in. We can take drugs from our teachers, our parents, the nurse, the doctor, the vaccinator. These are persons we should take drugs from. Not going to take drugs from your classmate. You say, it's like I have headache, please can you just give me that drugs first before my mommy calls, or your neighbor, or your age mate. No, these are the persons you should take drugs from. You should not take drugs from include strangers, someone you don't know, because you are having that symptom, because you are having that illness, or because you are just feeling you are not okay, you just see the person and you collect drugs from there. No. From your friends are not doctors. They don't know the right drugs to give to you when you have illness. Then visitors, we should not take drugs from them. Rules of taking drugs. Drugs are very useful, and drugs, we should not forget that we are taking it into our body, so we have to be careful, because anything you are taking into your body is either that thing is going to help your body or is going to destroy. So we have to be very careful when taking according to the prescription from a qualified or a well-trained health practitioners. The first one is keeping drugs out of the reach of children. There are some kids, once they just see the drug, say, yes, I know that my mommy used to give me this drugs anytime I'm coughing. You just go and take it without mommy or daddy telling you to do so. So drugs should be kept far from children. Taking drugs according to prescription only. If doctor say take 2 in the morning, you must take 2 in the morning. No doctor will say take 2 in the morning, take 2 in the evening. Then because you did not take in the morning, you want to take in the evening, you just take 4 once. No, that is wrong. You take only according to the prescribed way. Then before you take any drugs, you must check the expiry date to know if the drug is still good for you to take. Then visiting the doctor at the appointed time for checkup is also necessary. There are sometimes they will give you drugs. The doctor will not tell you, after taking it some days, come back on Monday to come and see, let's examine your health. You will not just bother, you just keep taking the drugs. No, it is wrong. Always visit the doctor for your checkup. Reporting any reaction observed after taking a particular drugs immediately to the doctor. If you notice any strange thing as you are taking drugs, the next thing to do is to quickly rush to the hospital and explain to the doctor. Not taking drugs on your own without supervision is very wrong. Mommy or daddy, uncle or auntie should be there. So an elderly person that knows about the drug should be there to direct you on how to go about it. These are some of the ways we can know how to take the necessary drugs. I think with this lesson, we'll be able to know how to stay away from bad drugs. See you in our next class. Bye.